Welcome to the deep dive. Today we're tackling healthcare in Jammu and Kashmir, a region where providing care is as much about navigating mountains as it is about, actual medical expertise. You've given us some great research on the government's role and the challenges they face, so let's get into it.
It really is a fascinating case. You have a government actively trying to improve healthcare, but they're facing some really serious obstacles, like difficult terrain, security concerns, and even the weather. It really highlights the resilience of both the people and the healthcare system.
So to get us started, could you maybe give us a sense of how healthcare is structured in J&K?
Sure. Picture a three-tiered system. At the base, you have your primary healthcare centers. These are your small clinics, community health centers, often in those remote villages. They're that first point of contact for basic healthcare needs.
So what sorts of challenges do these primary healthcare centers face in those really remote locations?
Well, I'd say the biggest challenge is honestly just accessibility. Imagine trying to reach a clinic when the only road is blocked by snow. And then there's the issue of resources. Making sure that these centers are adequately staffed and stocked with essential medicines, well, that can be a logistical nightmare.
It sounds like a constant battle against the elements. What happens when people need more specialized care?
That's where that second tier comes in. District hospitals and urban health centers. They can offer more specialized services, handle more complex cases. But again, their effectiveness really hinges on their accessibility and the availability of those skilled professionals.
And if someone needs highly specialized treatment, like for cardiac issues or neurosurgery or something,
that's when they need to reach the top tier. Tertiary care. These are the big players, medical colleges, specialized institutes. And the AIIMS, or the All India Institutes of Medical Sciences, those are renowned for their advanced healthcare. These facilities are typically located in the main cities like Jammu and Srinagar.
Given the geographic challenges, the location of these tertiary care facilities must be pretty strategic.
Oh, absolutely. The government has been proactive in establishing new AIIMS campuses, one in Jammu, another in Wanipura, Kashmir. This helps bring that advanced medical care closer to the people.
It sounds like the government is really putting in an effort to improve access. What other initiatives are they focusing on?
One significant initiative is the Ayushman Bharat, the SEHAT Scheme. It's a universal health insurance program covering every resident of J&K. It provides 5 lakh rupees, that's per family per year, for treatment at both public and impaneled private hospitals.
5 lakh. That sounds ambitious. While that coverage is impressive, what percentage of the population actually utilizes the scheme? Are there any limitations to its effectiveness?
That is a great question. While the scheme has the potential to be a game changer, well, there are challenges in making sure it reaches those who need it most. A lot of people in remote areas might not even be aware of the scheme, or they might face those logistical hurdles in accessing the impaneled hospitals.
So it's not just about having a scheme in place, but making sure it's actually accessible and people are using it.
Precisely. And that's where initiatives like mobile health units come in. These units are, they're essentially doctors' offices on wheels, bringing those healthcare services to remote communities, especially those cut off by those geographic barriers.
I've read a bit about these mobile units, and they seem like a lifeline for many people. What types of services do they typically provide?
Well, they offer a range of services, from basic checkups and vaccinations to maternal and child health care. They even have diagnostic labs and medicine supplies right on board. It's about, bringing healthcare to the doorstep of those who might not otherwise have access.
It's incredible how they manage to navigate those treacherous terrains. But what about, those times when even mobile units can't get through, like during heavy snowfall?
That's where technology can come in. J&K has been increasingly utilizing telemedicine through programs like eSanjivani, and it's connecting doctors to patients across vast distances.
It's like building a virtual bridge over those geographic obstacles. Can you give us an example of how this works?
Okay. Imagine a specialist in Jammu consulting with a patient in a remote village, maybe in Ladakh, and they're doing this all through a video call. They can assess the patient's condition, give advice, and even prescribe medications remotely.
So even when there are those physical barriers, technology is helping bridge that gap in healthcare access. What about using technology for diagnosis?
That's another area where J&K is making strides. They're starting to use AI-based diagnostics in district hospitals. It's about detecting diseases earlier and more accurately. And it, reduces the need for patients to travel those long distances for specialized testing.
It's fascinating to see how technology is being integrated at different levels of healthcare. What about those really time-sensitive situations, when every minute counts, especially in those high-altitude areas?
That's where the government's investment in the 108 ambulance service really comes in. These ambulances are, well, they're equipped with critical care equipment and are strategically positioned to respond quickly, especially in those remote or high-altitude areas. They even have air ambulance services for those really inaccessible zones.
Speaking of high-altitude areas, I know J&K has a high infant mortality rate. What's being done to address maternal and child health?
That's a key focus area. The government has programs like the Janani Suraksha Yojana, which incentivizes institutional deliveries, and Poshan Abhiyan, focusing on improving nutrition for pregnant women and children. They're also training local healthcare workers to provide those essential maternal and child health services in those remote communities.
It's inspiring to see how J&K is tackling those healthcare challenges on multiple fronts, especially given the geographic and logistical difficulties. But even with all these efforts, I imagine there are still significant hurdles to overcome.
You're absolutely right, there are. And those are the challenges we'll delve into next.
So we just covered a healthcare system that's really pushing boundaries to reach those in need. But you also mentioned there are some challenges, despite those efforts. What are some of those roadblocks?
Well, despite those amazing mobile units and telemedicine, one of the biggest issues is still that uneven distribution of resources. Tertiary care, with its specialized hospitals and treatments, it remains largely concentrated in those main cities.
So while we're celebrating these mobile units scaling mountains, there's this underlying imbalance that still needs to be addressed.
Exactly. Imagine, living in a remote district and needing specialized care, say for cancer or a heart condition. Traveling hundreds of kilometers to Jammu or Srinagar, it's not just inconvenient, it can be, life-threatening. We need to build up capacity in those underserved areas, bring that specialized care closer to the people.
So it's about more than just those initial points of contact. It's about having those specialists actually on the ground, not just reachable through a screen.
You got it. It's about strategically establishing more super specialty hospitals in those remote districts. But that also means making those locations attractive for healthcare professionals to actually work in.
So not just buildings, but creating an environment where those healthcare professionals can actually thrive.
Exactly. Think that the housing, schools for their children, career development, and of course, addressing those security concerns that might make professionals think twice about relocating. We need to make these postings, desirable, not just temporary assignments.
And that probably involves improving infrastructure as a whole, right? Not just hospitals, but roads, transportation, communication networks, everything that makes a place livable and functional.
Right. It's a multi-pronged approach. If we want to attract and retain top talent, those areas need to be well-connected, accessible, and thriving. It's about creating a healthcare ecosystem that's robust and sustainable.
Speaking of sustainability, how do preventative healthcare and community-level interventions fit into this picture?
That's a crucial aspect. It's about shifting the focus from just treating illness to preventing it in the first place. Investing in things like health education, promoting healthy lifestyles, addressing sanitation and hygiene. All those things can make a huge difference.
And that ties into the mental health crisis, right? Early intervention, community support, those can be crucial in addressing those challenges.
Absolutely. We need to break down the stigma surrounding mental health, create safe spaces for people to get help, and train more mental health professionals. And this can't just be in big hospitals. It needs to be happening at the community level.
So bringing mental health care closer to the people, making it a part of the everyday fabric of the community.
Exactly. Integrating mental health services into those primary healthcare centers, schools, even workplaces. It's about normalizing these conversations, making help more readily available.
Okay, so we have this long-term vision of a robust and equitable healthcare system in J&K. But what about right now? What can be done to address those pressing issues, especially those made worse by geography and limited resources?
This is where technology can really shine. Telemedicine is already making a difference, but we can go further. Think remote monitoring of patients, particularly those with chronic conditions, using things like wearable devices and AI-powered platforms.
Like having a doctor in your pocket, always there to support you. That could be especially helpful for those in remote areas who struggle to get regular care.
Right. It can help with early detection of problems, allow for quicker intervention, and potentially even prevent those, minor issues from becoming major health crises. And for those critical situations where physical access is really limited, drone technology holds immense potential.
Drones delivering medicine to remote villages, right? That sounds like something straight out of a sci-fi movie.
It might sound futuristic, but it's already happening in some places. Imagine a roads blocked by, say, heavy snowfall. But essential medicines can still reach a patient in need via a drone. It's about overcoming those geographical barriers, using every tool we have.
It's really amazing to think about what technology can achieve. What about AI's role in diagnostics and treatment? I've heard a lot about its potential.
AI is already being used to analyze medical images, helping diagnose diseases earlier and more accurately. But it goes far beyond that. Imagine personalized treatment plans based on a patient's genetic makeup and lifestyle, or AI tools assisting doctors during complex surgeries.
So it's not about replacing doctors, but it's about empowering them with better tools and more information.
Exactly. It's about human ingenuity and technology working hand in hand to improve those healthcare outcomes for everyone.
We've gone from discussing mobile units navigating mountains to drones and AI-powered diagnostics. It seems like J&K is really on the cusp of some truly exciting advancements in healthcare.
It really is an exciting time. We're seeing this blend of traditional approaches and cutting-edge technology, all driven by this deep commitment to improving people's lives.
Yeah.
But there's one more piece of this puzzle that we haven't really explored yet.
And what's that?
The integration of traditional medicine systems, like Ayurveda and Unani, into the mainstream healthcare system.
We've talked about the efforts to improve healthcare in Jammu and Kashmir, but you just mentioned traditional medicine systems, Ayurveda and Unani. How do those fit in?
It's interesting, isn't it? There's this growing thought that these traditional systems have a lot to offer, with their focus on holistic well-being, especially in a region like J&K, where Ayurveda and Unani are so deeply rooted.
But people see them as separate from conventional healthcare, right? Like they're totally different things.
Yeah, that's a common perception. But what if you had a healthcare system that combined the best of both? I mean, imagine the precision of modern medicine with the holistic approach of these traditional systems. A patient could get, conventional treatment for an illness, but also use Ayurvedic therapies to maybe manage stress or boost their immunity at the same time.
So it's about treating the whole person, not just the disease. That makes sense.
Exactly. And this integrative approach really fits with J&K's cultural heritage. Traditional medicine has always been such a big part of life there.
Okay, so how is this integration actually happening? Are there any examples of this in J&K?
There are some really inspiring examples. I was reading about this physician, Dr. Fatima, who has a clinic in Srinagar. She's trained in conventional medicine, but she also really respects those traditional healing practices.
Sounds like she's bridging the gap between those two worlds. What's her approach like?
Well, she might prescribe antibiotics for, say, an infection, but she'll also recommend some herbal remedies, to boost immunity, or maybe suggest dietary changes based on those Ayurvedic principles. She really looks at the whole picture, not just physical symptoms, but also the patient's emotional and mental well-being.
So it's about personalized healthcare, taking the best from both approaches. What kind of feedback has she gotten?
Her patients really love her approach. They say they feel like she really listens to them, understands them, and many of them say they feel more in control of their own health, which is so important.
It's great to hear those stories. They show how healthcare in J&K is changing. We've talked about government initiatives, the technology, and now this traditional medicine angle. It really seems like everyone's committed to finding ways to improve healthcare for the people there.
I agree. And it's not just at the policy level or in those big hospitals. It's happening, right there in the communities with people like Dr. Fatima leading the way.
It's about bringing all those pieces together, creating a healthcare system that works for everyone.
That's a great way to put it. And it brings us back to why we started this whole deep dive. It's about understanding what's happening with healthcare in Jammu and Kashmir, the challenges, but also those amazing efforts being made to make things better. From those healthcare workers going to those remote places, to the people using technology, and to those like Dr. Fatima bringing traditional wisdom into the mix.
It's really a story of resilience, innovation, and this commitment to make sure quality healthcare is available to everyone.
So as we wrap things up, I hope you'll continue to learn more about this. Do some research, find out about the people making a difference, and keep thinking about this important topic.
We hope this deep dive gave you a good look into what's happening with healthcare in Jammu and Kashmir, and maybe sparked your interest to learn even more.
Until next time, keep asking those questions, keep learning, and let's all keep working towards a healthier future for everyone.